Welcome back to the channel, guys. If it's your first time here, thank you so much for clicking on this video. Welcome to our channel where we post daily Medicare videos. Hey, real quick, whether you're returning or this is your first time on the channel, I would love if you would go check out our TikTok account. That's our biggest account, it's our main account. We post every single day, and I would love for you guys to go check it out and consider hitting the subscribe button and the notification bell so you can be updated every single time that we make a video here on our channel. But thank you guys for clicking on it. Let's get right into it. Okay, so this site right here, guys, is what they call Medicare.gov. It's Medicare's official website, so there's nothing fishy about it. No scams are gonna happen. This is the actual site of Medicare, which you can see in the top left-hand corner here. But why this is so important and why we use this with every single one of our clients is because you can put your doctors, your pharmacies, your medications, the whole 9 yards into this website, and it will show you all the different plans in your area and exactly how they cover your drugs. And so let's take a look here. Obviously, we don't have a Medicare number, so we're gonna go down here and go find plans now, but instead of clicking on login/create an account, we're just gonna go in as a guest. And so let's click find plans now here. And then what we're gonna do is continue as a guest. And let's just type in a random zip code. So we'll use my local zip code here in Missouri, 65804. Obviously, you would put your own zip code in here. Then you click continue, and then whatever type of plan that you're looking for, whether that's Medicare Advantage that has drug coverage or prescription drug plans, you can select that, and that's the type of plans that you're gonna see. So for this example, let's just put drug plans. So we'll put Medicare Drug Plan Part D, find plans now, and then it's gonna ask you a little bit about yourself. Since we logged in as a guest, it's gonna ask, hey, do you have Medicaid? Do you have supplemental security income? Are you a part of a Medicare savings program? Do you receive extra help because you're lower income? So if you know any of those in your specific situation, go ahead and put them in here. But if not, it's okay. Just click, I'm not sure, I don't get help with any of these programs. Then continue. And then it's gonna ask, do you want to see drug costs when you compare plans? To definitely put yes. And then this is where you can pause the video if you're following along and doing it together, because you're gonna need to pause it and add all your medications. But let's say, for example, you're just watching this video, you're not actually doing that. So let's just put in some to see here. So let's do lisinopril. That's a common one that we see a lot. So you'll just put in lisinopril. It's gonna ask for the different dosages. And so you'll put in your exact dosage. And then it's also gonna ask the quantity. So how many do you take every day? Do you get them in a 90-day supply? Do you get them in a 30-day supply? So you can tailor it exactly to your situation. So there's lisinopril. Let's put in hydrochlorothiazide. That's another common one. We'll just keep it the regular, the way it is. And then let's put in an insulin because that's a little tricky. So if you're on any insulins, you may have seen that the insulin program, the drug cap for insulin, is $35 when you pick it up. So you can't be over that. Well, if you put in a generic version on here, it doesn't always show that that cap applies. So it may show that you're paying more. So when you're putting those in, make sure and put the name brand that you take. So for example, let's type in Novolog. Novolog's a pretty common insulin. It's gonna ask if we wanna put the generic or keep the name brand. We're gonna keep the name brand, and then looks good. We get it in a pack of 5, 100 unit milliliter, and then we get 1 a month. So we're gonna put that in here. Let's put in a couple more. Let's do metformin. Metformin is a common one. There's a lot of different ones, but we're gonna do hydrochloride. Boom, that looks good. And then let's see here. That looks good. We'll just keep it those 4. So we got our medications in there. Boom. That's most of the battle here. So now we're gonna go down and click done adding drugs. And then it's gonna ask you, hey, what pharmacy do you wanna pick these up at? whichever one you want to do, it is going to tailor to your area, whatever zip code you put in there. So let's say, for example, I don't really have a pharmacy specifically that I want to go to. Well, I'm just going to put in a few different ones and see what's the best price. Because all these different carriers will have, well, Walmart might be their preferred one, while another one might have CVS as a preferred one, or Kroger or Hy-Vee. Just depends. So let's put in mail order. Let's put in CVS. Let's put in Walmart. Let's put in Walgreens. That'll give us a good one here. So then once you're done adding your pharmacies, you're going to go down to the right-hand corner, click done. And then it's going to show you all the different drug plans in your area, whatever zip code you put on there, and exactly how they cover the medications that you plugged in there. So just a little word of advice on drug plans, standalone prescription drug plans. The first one that pulls up is almost always going to be the best one for you, because they sort them from least expensive out-of-pocket cost to most expensive. So if we're scrolling down here, the first one that pulls up, the cheapest, has a $37.30 a month premium. So you will pay that premium every single month if we were to enroll into this plan. And then it also shows you your total drug cost out of pocket when you actually go and physically pick up the medications and the premium, monthly premium combined for the whole year. So if we were to get on this plan, it looks like for all 4 of those medications plus the $37 premium, we're looking at about $867.60 out of pocket for the whole year of 2025. Now, if we scroll down here, we can see the next one, $69.80. Well, our total out-of-pocket cost is just shy of $1,400 for the same 4 medications. So it's important to do your research, because a lot of times you can save money by just getting on the cheapest plan that covers your medications the best. Because if we keep scrolling down here, I mean, $1,700, $1,946. So you can really mess yourself up. Now, I do want to point out one thing here real quick. You can see that this drug plan, WellCare Value Script, has a premium of $0 a month. Well, most people would think, hey, it's a $0 plan, it's going to be the cheapest one for me. Well, if you look at the out-of-pocket cost for picking up the medications, well, it's $2,000 versus the one up here that was $37. You're only going to be out $867, including this premium. So it doesn't always mean that the cheapest one is always going to be the best one for you. Now let's take a look a little bit deeper here. So now we know that this is the cheapest one for those 4 medications. We can go into plan details right here and click this button and scroll down to, well, let's just click drug coverage right here. It's going to pull up the specific medications, what tiers they are, if they're considered generic or brand name. It's going to show you all the pharmacies that we put in, if they're preferred or in network. And then it's going to also show you how much they actually cost throughout the year. So looking at this here, Walgreens and CVS are at $456, while Walmart, being preferred, and mail order being preferred, have them for $420. So this is your total out-of-pocket cost for all the medications for the whole year, and then all you have to do is pay that premium per month. So keep scrolling down here. It's going to show your out-of-pocket cost with the premium. So total drug cost with the premium for 2025. And then it's even going to break it down monthly. So you see at Walmart, looks like you're paying $35 a month. So if we scroll down, I'm assuming, let's see here, yep. So hydrochlorothiazide, lisinopril, and metformin don't cost anything for the whole year. So that $420 is literally just the $35 a month for the Novolog. So you can kind of play around with this, see which one's cheaper, see if you can have your doctor, if you have one that's really expensive, you can have your doctor prescribe you one that's a little bit less expensive and might be more affordable for you. Or you can reach out to us. We help people every single day do this and get on the cheapest plans for them. We're licensed in all 50 states. We can help everybody. But I have also linked down below Medicare.gov, this official Medicare site where you can actually run this for yourself. Should have said that at the beginning of the video. But that's in a nutshell how you find the best drug coverage for a separate standalone prescription drug plan that will go with a Medicare supplement. Now, don't worry, if you do want to go with Medicare Advantage that has built-in drug coverage, all you got to do is either at the beginning, you'll click Medicare Advantage Part C plans instead of the drug plan, or once you get in here, you can actually go up to the top right-hand corner right here and click View 34 available Medicare Advantage plans. So now it's going to load all the Medicare Advantage plans. There's 34 in this specific area, and it's going to show you all the different ones and how they cover your medications. On the Medicare Advantage side, it's also going to show you, if we were to click into this one because it's the cheapest, it's also going to show you all the drug coverage like we just looked at, but it's also going to show you your monthly premium for the plan, if you have any deductibles, any drug or health deductibles. It's going to show your max out of pocket for the year for your health or medical, and it's going to show you all your different copays that you're responsible for. So primary care doctor, specialist copay. It's going to show all the different things that you're responsible for if you actually use your plan for medical or hospital related things. Thank you guys so much for watching the video. If you're still here, that means you like the content on this channel. So I would highly encourage you to go click that subscribe button and the notification bell so you don't ever miss another video that we put out. Guys, thank you so much for watching this video, and I'll see you in the next one.